Hi everybody, it's Amy, and today we're doing STDs, part 2. In the last video we started talking about some STDs. Today we are continuing first with HPV, which stands for human papillomavirus, or genital warts. Yay. Nearly 1 in 4 people carry this virus. These can show as warts on your penis, your vulva, around the anus, on your cervix. They may be very, very tiny, like a little cauliflower. Sorry if I just killed cauliflower for you. Or they could be flat, or they could be invisible. This is spread by genital or oral sex with someone who has HPV. And like a lot of STDs, there may be no symptoms. Warts may not appear for weeks or even years later. And this can also spread very quickly. Women, you may be able to discover that you have the HPV through an abnormal pap smear. This is very dangerous. There is an extra risk of cancer of the cervix, of the vulva, the penis, or the anus of people who have HPV. Even if you never got the first wart. In fact, most women who have cervical cancer have HPV. Babies can be born with warts in their throat or their lungs. For the warts themselves, they can be frozen off or burned off with an electric needle. There are also ointments that work, but this is a virus. It's a virus, so there is no antibiotic for it. There is an HPV vaccine, and ideally, you should have that vaccine prior to being sexually active. All right, next is Manila. Manila is yeast, and it is an infection due to fungus. It is normally in the vagina, and it can be related to warm climates, to pregnancy, reactions to medication, and it is rarely sexually transmitted. Women will notice a discharge with itching and burning. It is not dangerous unless you are beginning to get these infections frequently. All right? Basically, the way to avoid this is with some good hygiene, ladies, but not douching. You should really avoid douching unless it is something that a doctor prescribes. Wear cotton underwear. Avoid tight clothing. You can use an antifungal, which is over-the-counter medication. You do not need a prescription for it. You used to in the old days, but you don't anymore. All right, next is pubic lice. Woo! Also known as crabs. These are tiny little crabs that live in the hair around your penis or your vagina. Not only can you get this through sexual contact, but you can also get it from infected towels, infected bedding, and clothing. So if somebody has crabs and it's in their jeans, I don't mean their DNA, but in their blue jeans, and they loan you the blue jeans, and now the crabs are on you. All right? This lice can get under your skin. It can cause itching. And while it isn't dangerous, it is highly contagious. Once you have crabs, they can move to other little hairy parts of your body. Once you scratch and then touch your face, it can even get somewhere like your eyelashes. If you scratch yourself and then, just do that. Now you've transferred it. You can use over-the-counter methods like RID to get rid of crabs. And make sure your partner is treated too, or you're going to keep passing it back and forth to each other. You have to clean all clothing and bedding that might be infected too in super hot water. Remember, the more that you scratch, the faster it's going to spread. All right, scabies. These are tiny little mites that burrow under the skin. This is actually something you can get from a toilet seat, or by sexual contact, or by even kissing or hugging. You can get it from sleeping in the same bed with someone who has it. You can also get it from an infested pet. You'll will notice little reddish zigzags under your skin, usually in the genital area or the buttocks, also around your fingers or any skin folds like elbows, wrists, underarms, breasts, feet. You will also have painful itching, and itching and scratching really makes it much worse. It is easy to spread, but it is not dangerous, and it is common. There are prescription creams that you can use. Again, you have to wash clothing and bedding in very, very hot water. All right, syphilis. This syphilis is from a little spiral-shaped bacteria that enters your body, usually through sexual contact, and this bacteria can affect your organs. You can also pass this from an infected person to an opening in the cut of the skin of someone else. Syphilis has stages. From 10 to 90 days after exposure, you'll get a red, painless spot in the site of the infection, the penis or the cervix. It can be on the lips, the mouth, or the anus. And this little red spot then, it was there, painless, and then it goes away. So you think, oh, I don't even know what that was, right? But stage 2 happens, and that can happen weeks or months later, and you'll get a sore throat, and a fever, and an itch. You could also have a rash on your body, the palms of your hands, the soles of your feet. It can really attack almost any part of the body. It can even cause your hair to fall out. Stage 2 symptoms may disappear and then not reappear for years. Okay? Seriously, like 5, 10, 20 years. And stage 2 can go and come back 20 years later. By that time, because it was untreated, when it comes back, it may be fatal and or attack your nervous system. If it attacks your nervous system and then you get treatment, the bacteria might be defeated, but the damage that it does to your nervous system cannot be reversed. An antibiotic or penicillin can kill syphilis. It can be passed to an unborn child, and the child can be born with extremely serious birth defects if the child survives. Don't play around with syphilis. All right. Last but not least is trichomoniasis, or trich. This is an infection of the vagina or the urethra in men. It is a tiny protozoa that can live in most places in the body. Not only can it be spread by sexual contact, but it could be in damp clothing, towels, bathing suit of an infected person. The protozoa can live outside of the body for hours. Women will have a greenish yellow discharge with an odor, painful urination, inflammation of the genitals, and sometimes abdominal pain. Men will also have a discharge and discomfort in their penis. Trich can be in your body without symptoms for years. It is not really dangerous, but it is pretty common. There is a prescription treatment for it, and you and your partner will both need treatment. As with all of these, I cannot recommend condoms enough. You should also be using dental dams. You know, here's the bottom line. I don't want to hear about how condoms are not comfortable, that you lose sensation. Let's weigh this out. A simple purchase, and it might save your life. Okay? That's a pretty good trade. All right? Condoms, and dental dams. Something so easy to use, and something that can make a huge difference and maybe even save your life. And because condoms are so vital to healthy sexuality, the next video I will do will be on proper condom use. So until next time, please subscribe to this channel. Please feel free to get in touch with me through Facebook, through Twitter, through Instagram, or through this channel, which some of you have been using to get in touch with me, and that's fantastic. I love communicating with you. And until next time, be well.